Good evening, everyone, and a warm welcome to our webinar on nutrition and active aging. I'm Joyce. What is active aging? Active aging is an idea that by maintaining health, remaining physically active, cognitively active, and taking part in various social activities, a person can feel their best as they age. Most of us here, am I audible? Can
Yes,
you
you
give
are.
me a thumbs up
Yes,
if I'm audible?
you are audible.
Audible,
Yes.
madam.
Thank you,
Audible,
Doctor.
madam.
Thank you, Doctor. Yes. So sorry. Yeah, we'll continue. And most of us who have joined here do understand that health isn't just what we eat, it is how we eat and our entire relationship with the food. Let us today hear from our experts on how we could keep both our body and mind healthy and happy by bringing about very small variations or changes. Before we move forward to our main topic, I would like to give you a brief on Vayah Vikas and our initiatives. Vayah Vikas is a registered trust with a dream to build and strengthen an ecosystem for seniors that empowers the seniors to lead a productive and meaningful life. We are a community of senior citizen members enabled through an online platform with a focus on wide range of services starting from legal, health, and engagement. Moving on, let me quickly tell you how each one of you could participate in our event today. It would be a 40-minute session followed by a quick question answer session. All of you would have the opportunity to submit your text questions in the chat window available. We will collate the questions and present it to and address them to our presenters towards the end of the session. I request each one of you to kindly mute your devices once we start our session. Please do not forget to give us your valuable feedback. The link for the feedback will be shared in our chat window. Without taking too much time, let me introduce our speakers for the day. Today we have with us Dr. Rekha Bhatkande and Dr. Anand P. Ambali. A warm welcome to both our speakers. Moving on, I would like to start introducing Dr. Rekha Bhatkande. She is a consulting geroenterologist and is currently the Dean and one of the directors of Shishrusha Citizen Cooperative Hospital, Mumbai. She is the president of Family Welfare Agency, Mumbai, president of Dilasa Group of Senior Citizens, Dadar, vice president of Federation of Senior Citizens of Mumbai. Her areas of interest are public health and health advocacy. Her publications are Gastromucormycosis, Indian Journal of Gastroenterology. She's also been awarded the YB Chauhan Pakistan Award. A warm welcome to you, Dr. Rekha. We also have Dr. Anand P. Ambali with us. He has completed MD in General Medicine from BLDE-DU, Shri B.M. Patel Medical College Hospital and Research Center, Vijayapura. Postgraduate Diploma in Geriatric Medicine from MS Ramaya College Hospital. Certificate course in Essentials of Palliative Care, and trainee in short courses in gerontology by International Institute of Aging, United Nations. He is a scholar of Commonwealth Commission for MSc in Dementia from University of Stirling, Scotland, Fellow of Geriatric Society of India, Indian College of Physics and Royal College of Physicians, Edinburgh. He has presented several papers in the gerontology conferences and has several publications in various journals, magazines, and books. He has also been awarded several awards during his career. He is presently the Vice President of Geriatric Society of India and holds several other prestigious positions. Thank you, Dr. Rekha and Dr. Anand, for being part of our webinar. Over to you, Dr. Rekha, to take us further.
Oh, wonderful. Thank you so much. Uh, I'd like to thank Vayah Vikas for, inviting me to be a part of this seminar and to be able to be on the same platform as Dr. Anand Ambali, who is a geriatrician par excellence. I mean, you can see that with all his attachments and all his, affiliations. And the topic is wonderful: nutrition in the elderly. And uh, you know, 400 years ago, Hippocrates, who is the recognized father of medicine in the Western world, said that let food be your medicine. And Dr. Anand is going to tell us all about how food is going to keep all of us senior citizens healthy. But what I am going to now discuss with you is something clinicians usually don't talk about. And that is, how do we keep our food healthy? See, the safer our food, the less likely we will fall ill from foodborne diseases. And as we get older, our immune systems are obviously going to get weaker. And there are also other age-related changes in our body, which in our digestive system, in the processes, and that's how it makes us more vulnerable to foodborne diseases. Now, the global burden of foodborne diseases is quite large. 1 in 10 people around the world fall ill after eating contaminated food. I mean, that's a huge burden. And so, what are the foods that are likely to be contaminated, and cause this illness? See, the first thing is raw food. Anything that is raw. It could be a fruit. It could be a vegetable. It could be your non-veg or meat, eggs, milk. Anything like that is going to be a likely uh, uh, target for harmful bacteria. And when they thrive there and we eat that, that's how we are going to fall ill. Now, remember something: seafood, cold cuts, all these things that we take for granted, we have no clue that they could actually be the cause of our illness. Now, remember, our hands carry germs. The chopping boards that we use in the kitchen, those carry germs. The kitchen surfaces themselves, the burtons we use, they all carry germs. So keeping our everything that is related to food, food storage, food cooking, food serving, we have to keep everything clean. That is the first principle of keeping your food safe. And the other is that, of course, we need to wash our hands, and that is a foregone conclusion before eating, before cooking, before eating, after cooking, after eating. I mean, before serving, especially if you're serving the elderly, feeding, all that, of course, is a part of hygiene. Now, in these days, we find, Dr. Anand, you'll agree with me, that a lot of people are eating packaged foods. In fact, the GST has made quite a killing, I would say, because, the GST on packaged foods have gone up. So I would say that when we look at packaged foods, there's one caution I need to bring to all of us here. If you buy a can of food, any food, it could be non-veg, veg, whatever, anything that is canned, and you see that the can has puffed up, that the lid is not, flat, it has puffed up. It doesn't matter how expensive that can is, please just throw it out. When in doubt, throw it out. Okay? Because from that contaminated canned food, you can get a very deadly disease called botulism. So please don't even take a chance. You think that the can is not in a pristine condition, just junk it, right? The other thing is, when you look at labels. See, when you look at labels, you will see that they have written use before, use before this date, or consume before this date. Now, unlike in medicines, it doesn't mean that the food is going to go bad, but the quality of the food has deteriorated. So if we use our packaged or canned food before the date that they've said, use before, then obviously it's going to be safe, and the quality is going to be the same as when it was packed. Another very important thing about safety of food is the temperature of the food. Okay, so what is safe food? Safe food is the food that you can cook. When you're cooking above 100 degrees centigrade, the food that you cook is safe. Something that can be boiled, that's safe. Something that can be peeled, like a banana. So the skin of the fruit or the vegetable is keeping the the item inside, the food item inside safe, or something that is vacuum sealed, like your packet of biscuits. But here also, I want to tell you something. Very often we fill our jars with spices, and we really don't look at the spices till they're over, and then we fill it or refill it. Remember one thing, after 3 months, please check for changing color of your spices, whether it's haldi or chili powder or any spice, and always look at the surface of the spice. If you see a white patina, that means, there is, if it's a red chili powder, there's no business of any white thing there, then in that case, there is a mold or a fungus that has grown there, and so please discard that. Okay, because we may be taking a pinch, but we have no clue what is the quantum of pathogens in that, right? So like fungus or germs or bacteria or viruses, so we must be very careful. Now I was talking to you about the heat, the temperatures. Now, people always say it's like this: if you cooked your food, you can safely keep the food out on the table for 2 hours. After that, the temperature of the food will come down. If we're talking in centigrades, it will come down below 70 degrees, that is about 60 degrees centigrade. And below 60 degrees centigrade, food is not safe. Bacteria can multiply in that food. So cooked food on the table for 2 hours. If you cannot consume it, back in the fridge. Reheat it. Then you'll ask, what happens to our kids who take food to schools and colleges and the office? You're taking chapatis and you're taking rotis and you're taking vegetables. Remember, these are dry items. The moisture in them is not that much. If you were to ask me, please never ever take dal and rice packed in your dabba to your place of work. I mean, don't let your family do that, because it may be there for many, many hours, and the cereal, that is your rice and your dal, can actually be contaminated with bacteria. Okay. Now the thing is, what about food that is kept in the fridge? So usually the food in the fridge is at about below 8 degrees, around about 8 degrees. 4 to 8 degrees is 7 degrees is the temperature in the fridge usually. And so that's okay. But if there is something that we need to put, raw food that we need to keep, please keep it in the freezer. The temperature in the freezer is usually minus 18 degrees in the centigrade. And of course, where this Fahrenheit is concerned, of course, it is 0 degrees there. Now, when you take food out of the freezer, that is, it could be your raw, your non-veg foods, raw foods which are there in the freezer, or it could even be pulp of your, like mango pulp or something people freeze over a long time, a long period. Remember one thing, that when you take it out of the freezer, never put it straight on the table. Keep it in your freezer and let the temperature come down gradually and then take it out. All this I'm telling you because this is food safety. So the food you eat must be safe to consume. And the danger zone, that is 6 degrees centigrade to 60 degrees centigrade, that means food that has come out of the fridge and food that is now has not been reheated is in the danger zone. So remember, when you take food out, if you're going to keep it for more than an hour or two, please reheat it and then consume it. All right? So these are the few things that I wanted to tell you, because if we don't do this, our food's not safe. And if our food's not safe, you're going to land up getting gastroenteritis and everything like that. Yes, so the question asked by Shaila is that if we were to reheat, don't we destroy nutrients? Now I'll tell you, Shaila, what are the nutrients that get destroyed by heat? One is vitamin C, okay? And that any cooking is actually going to destroy vitamin C. So if you have noticed, in Indian serving, when we serve food anywhere across India, right from Kanyakumari to Kashmir, we always keep a slice of lemon in the plate. And you want people to actually squeeze a lemon over the food. That is uncooked vitamin C. Because cooking is going to destroy vitamin C, no question about it. Right? So I totally agree with you that there are nutrients that would get destroyed. Some actually enhance. Their whole absorption is enhanced because of cooking or because of heat. So I think that is it. Anyway, and safe food is good food, and I'm sure when Dr. Anand talks to us about what food we need to eat and how much we need to eat and what are the diseases that can be prevented and what are the diseases can be cured. I mean, this was just a rider just to tell you that whenever we're talking about food, the food that we have, what we store, how do we store it? How do we eat it? How do we cook it? How do we reheat it? How do we carry it with us? If you're going on a picnic and you're carrying food, which is not dry food, like Gujaratis are very fond of carrying their theplas and, their, so they know those are dry, they're never going to get bad. But if we're going to carry other food, then I would suggest you carry your boxes. You carry the boxes which will keep the heat, when insulated boxes, so the hot stays hot, and even the cold. When you take cold out onto the table, you can only keep it for 4 hours. Anything beyond that is again goes into the danger zone. So makes the food untied. So Dr. Anand, I would now ask you that there's so much that you are going to tell us about how once everybody knows, okay, they're eating safe food. Now, what is the food that they should eat to stay as healthy as possible? Please.
Dr.
You are
Rekha, just one more question from Mr. Ashok before Dr. Anand starts. His question was regarding temperature. What about dabbawalas, the food that is given out to people at workplaces where the dabbawala.
So what I would suggest, that if you have to send dabbas, if the dabba cannot reach you within the 2 hours that you have cooked and sent it, then please choose the food items you're going to send. Choose them well. I'll tell you which are our preservatives, everyday preservatives. Okay, a food that is cooked in oil, not a good choice. Dr. Anand is already frowning at me, but that's a safe food. That's a safe food because of the heat at which that oil has cooked it. But please be very wise in what you pack into your dabba to be sent to your family at workplaces or to children's schools or colleges. In Mumbai, I like to tell you, the entire Mumbai is dependent on our dabbawalas. It is such a wonderful system of management that Harvard and Kellogg's, management schools are talking of raving about it. But their service is very quick, very quick. And usually they pick it up at the time when we actually, just about are ready to have our food in the office. If it's going to be delayed, then pack that dabba with wise choices. And of course, peeling the fruits is always a good thing. But remember one thing, you take away the peel, like you take an apple and you take the peel off, you're actually removing the fiber. You're removing the nutrients, you're removing fiber. So, you have to have a very nice balancing act with what you do and how to keep yourself, how to keep your food safe. Thank you, Genevieve.
Thank you, Dr. Rekha. Over to you, Dr. Anand. Thank you so much.
Yeah, that were very wonderful insight over the food safety. A lot of things happened to be learned today from Madam. In continuing to the next aspect of, am I audible, right?
Yes, doctor, you are.
Yes. Is my screen
Yes.
visible? Yeah.
Yes, it is. Yes, doctor.
Okay, fine. So, now in next 20 or 25 minutes, I will take you from the other aspect of nutrition. Madam has rightly brought out about the nutritional safety issues. I will talk about my experiences and evidence-based practices regarding the nutritional aspects in the older people. So we will concentrate only on 3 aspects today. There'll be what are the risk factors for poor nutrition in older people, what's the impact of nutrition on the quality of life, or the poor nutrition on quality of life, and how to maintain proper nutrition. Most of the questions have been answered by Madam regarding third point. So I think I will concentrate more on the risk factors and how quality of life it gets impact. So as Madam told, and the Vayah Vikas has brought this apt topic on nutrition. So very rarely such topics are discussed on social flora for senior citizens. But I congratulate the team, Jenny and the whole team, Sugandhi, Malika, for bringing this very important aspect. Because the older people here, which I have seen on the screen, they are very active, they are healthy, and they are being part of active aging. That's how they are part of your deliberations today. So that's a good thing. But again, we should not ignore certain things in the old age that can lead to nutritional imbalance. Now, what nutrition determines in our body? As Madam rightly told, food has to be there, it should be safe, it consumed. Now, after consuming, what does it do for us in our body? The nutrition plays a very important role in maintaining the physical aspects of our life, keeping us active. Cognition is very important. Our memory depends upon the large amount of sugar that goes to the brain. Vitality, yes, we come across the older people keep telling that I want a lot of strength, I want a lot of strength. I want to work like I was working 10 years back or 20 years back. Of course, the quality of life, the various markers depending upon the situation they are in. Longevity, of course, nutrition determines longevity. How long will you depends upon the quality of food, type of food, the number of diseases that we are having. And nutrition determines our immunity. Good nutrition, good immunity, a strong immunity rather, I say. And if any one of this gets imbalanced, then it leads to a disease process. And that disease will lead to inactivity to some time before they get recovered. I again endorse Madam's views that deterioration of health due to nutritional disorders is rapid, while recovery is very slow, very slow. We'll come back to this statement again. So we call nutritional disorders as a malnutrition. Mal means bad. The Greek meaning of mal is bad. So any bad thing, whether it is too less or too high, both are bad for the health. So malnutrition is that is less as well as that is too much. So is a state in which deficiency, excess or imbalance of energy, protein and other nutrients. What it leads to? It leads to adverse effects on body form, function, clinical outcome. So just I'll quote you some few examples of over nutrition or excess nutrition: obesity, hyperlipidemia, hypervitaminosis. As Madam rightly telling, we're running loss of vitamin C, while we see a lot of older people consuming vitamin A, fat soluble vitamin, vitamin D, and other vitamins which are more dangerous in excess. That has to be kept in mind. And hyponutrition, the other aspect is hypo. So when we talk about malnutrition, it is either hypo or hyper. So in hyponutrition, there is a loss of proteins, hypovitaminosis. Chronic diarrhea is a one condition where older people, they lose a lot of micronutrients and they develop deficiency of vitamins. Edentulous is one of the commonest cause in older people leading to hypovitaminosis. Loss of taste, what you call it, dysgeusia. One of the commonest feature in older people manifesting as fever. In older people, when they develop fever, the threshold of the fever center is too high. So they come to the clinician as loss of taste, decreased appetite, dry mouth. All those things are suggesting that there is a hidden disease going in them. Poor fitting dentures, another commonest cause. Swallowing problems. We have a lot of elderly people coming to say that every time I eat even chapati, I had to drink water. For every piece I eat, I have to drink water. The swallowing problems are there. And it has been recently found that older people staying in old age home, maximum number of them, they suffer from undernutrition or hyponutrition. Now, this is one of the commonest issue in the older people who hesitate to talk. But let me be clear in front of the senior citizens. Constipation begets constipation. Now, if you go and senior citizens come to the hospital, he hesitates to tell. He thinks that I should not talk about this constipation to talk. But how it affects the health, it affects the nutrition. So just fear of passing stools, he has to compress. What he does, the old man eat less because he wants to avoid that issue every day. So he is fine with passing stools once in 3 days. That's a very surprising things we see in older people. So they eat less. So they should not get constipation. That's the biggest wrong thing that they're doing. Second, because they eat less, again, it leads to constipation. Constipation leads to hemorrhoids or piles, and piles leads to bleeding into anemia. Anemia again leads to constipation. So this cycle continues in most of the older people where they need to be careful. So whoever is having an issue with passing stools or constipation, please talk openly with their family doctor and get this issue solved. Now, in old age, what are the factors that affect food intake? Obviously, smell. The moment for all of us, it's the smell that first gives us the appetite. The moment we smell the sambar or dosa smell, so our taste buds also start watering. So smell is still the factor that improves the appetite and they make the mouth watering. Taste, most of the older people, they lose the taste buds because of the drugs that they're using. Or here we are seeing a lot of people, older people, they chew tobacco. That's another cause. Vision, yes, they have to see the food also. If you have brought for good colorful food, so that again improves the appetite and people tend to eat more. If the old lady is staying alone and she's cooking self, then maybe she's not very keen after some years that she feel bored. I don't feel like eating the same stuff every day. Or if somebody else is cooking, she may not like whatever she's, because in the older people, 8-year-old, if she depends upon the daughter-in-law, so whatever daughter-in-law cooks, she has to eat. So again, that affects the food. And mobility. If the older persons are chair-ridden or bed-ridden because of decreased appetite or decreased intestinal movements, the older people don't feel like eating more food or quality food. Then number of diseases that an old man is having. If there are more than 3 or 4 diseases in an older person that affects the food intake. Depression is one of the commonest symptom or disease that can either lead to hyponutrition or hypernutrition. So one has to think, if the old man is becoming very fat, then easy getting in depression. Or if he's losing drastic weight, easy going in depression. And tobacco and alcohol, of course, are the commonest cause, and accessibility to the food. Most of the older women, if they had a fracture or they reduce mobility or they are differently abled in terms of blindness, they cannot cook themselves. Accessibility has an issue where it affects the food intake. Now, again, the factors I was telling you, medicines, apart from the doctors that we write medicines, one of the commonest drug that is misused even by the older people on the counter is pantoprazole. Every day they say, I got acidity, I like to use some drugs. So that is the biggest culprit, which reduces the acid flora in our stomach and creates more health issues than helping the patient. So if you have that issue, and second is painkillers. In and out for knee joint pain or any pain, they keep taking painkillers, and that affects the food intake. Psychological, bereavement. Recently, a spouse dies. So obviously, in our clinical scenario, we don't ask how is your appetite. The old person who has come after 1 week of loss of his wife or a husband. So we don't, because it takes months to overcome that, and then that will be a part of their routine, and then they start eating once they come out of this environment. Depression, I'm telling you, dementia. And if an old person is coming with reduced appetite for a few weeks or few days, always think of he is suffering from organ disease or organ failure. So it can be simple as the commonest diabetes, infection, pneumonia, urinary tract infection can all present to you as an reduced appetite. Now, the adage here is the older people keep telling that abhi umar ho gaya, abhi umar ho gayi, hone wala hi hai. No, if your appetite is getting less, even then you should think that either you have an infectious process taking in your body like pneumonia or intestinal infection, or one of the major organs is getting affected. So immediately consult a physician to rule out the possibility. So I'll just tell you how, again, the scenario in a clinical, as a clinician, a geriatrician, what we come across. This was a 100-year-old lady, female. She came to me with anemia. Now, she was 100 years and her children are in very well-to-do position. But in such a well-to-do family, a 100-year-old lady coming with hemoglobin of 4.7. So it is not that there was any medical issue with her. She was not having any medical issues. She was subject to abuse. She was not provided adequate food in the home, nor even the water. So that is how she developed anemia. That is how the history was provided by her. So what I want to try to convey here is, it's not only the disease, physical disease, even psychological, is the elder abuse, social factors also play a very important role. We had another old man coming to us with anemia, has been evaluated extensively by many clinicians, and he has received 2 blood transfusion already before he came to us. And his hemoglobin was 5 when he came to me. And we also immediately did a blood transfusion so that he can keep moving. And one day I just visited to his room without knocking during our rounds. And what a surprise to me, what I saw in his room, what he was eating. He was provided with bread and water only by his family. So 2 or 4 pieces of bread and a glass of water 3 times a day. Now imagine how can he develop high, like he has to develop anemia and all the nutritional disorders. So these are the extreme cases of elder abuse that we come across, and one of the commonest reason for them is anemia. Okay, and there are some older people who do self-medication. This is a very classical example what we get in the old man. He has in his own home that loperamide and bisacodyl. Whenever he feels loose motions, he takes this loperamide capsule, and whenever he develops constipation, he takes bisacodyl. Self-medication is the worst thing, and because of this alternate constipation diarrhea, which is self-made, has led to a lot of nutritional disorders, hypovitaminosis in him, and that is how he came to us. And when I saw him, why is that this is happening? If Madam agrees that whenever we talk in history, science, that if the person is coming with alternate bowel habits, the first thing that comes to our mind is a malignancy or a cancer. But while taking this history, we notice that it is self-made. He's taking tablets for loose motion, and once he starts loose motion, then he takes tablet for constipation. So this is how the older people behave and lead to nutritional disorders. And one of the important that cultural practice that goes in our society, especially in the Gujarat areas and all, that Santhara is there. So here the older persons purposely stop or voluntarily stop eating, and they go for fasting. And in fact, it is celebrated. It is celebrated as festival of death, and whole family members, they support such issues. So that is happening. So most of they feel that I stop eating, yes, I will die soon. This is a very concept even in the older people admitted in our hospital, where they don't have any caregivers or family members are not willing to provide care. They just stop taking food. They say that I want to die. I don't want to live anymore. Now, coming to the second part, how it impacts on quality of life. It affects immunity. I was telling you, it will make you less immune, more prone for infections like pneumonia and all the diseases that even upper respiratory tract infection. There will be a drastic reduction nutritional impact in acute and chronic illnesses. Nutrition in both poor and excess leads to disease. That's what I was telling you. I'll show you some examples. There is a delay in healing of wounds. It leads to muscle loss, weight loss, and nutritional frailty. This is a 2 important aspect. Muscle loss is different, weight loss is different, which you'll come to know what happens. Now, nutritional disorders can also lead to heart attack, hypertension, diabetes, anemia. I'm telling you, in older people, osteoporosis, bones become very weak for that, malignancy, and obesity. As Madam rightly mentioned, I just like to endorse by a quote: to eat is a necessity, but to eat intelligently is an art. Okay, so that is how we have to train our older people regarding the nutrition. So how it affects the quality of life? It leads to anemia. So what? As a physician, we see a lot of patients anemia starting from middle age to the old age. Now, in older people, anemia leads to reduced activities and instrumental activities like driving the car or going for a shopping. The old man who was earlier going for a morning walk for around 2 kilometers, slowly he starts to 1 kilometer, then in the home, then he restricts to himself to the home. That should be the warning sign to tell that he is suffering from the disease which is restricting his activities. And anemia precipitates heart failure, leads to falls, again constipation and reduced appetite. So this cycle keeps on going, and the old person lives with a poor quality of life and poor recovery from the diseases. We had a recent an 80 years old man who was very fond of diet, and he lost muscle bulk in the buttocks. And what was his problem? Why should I tell you? When he lost the muscle bulk in the gluteal region, he was not able to sit. That was the biggest problem. Wherever he used to sit, his bones used to touch the flat surface, and he has to move doctors to doctors. At least when he came to me, he has met already 8 doctors. Later, I came to know that he has gone to 2 and 2 more to solve this issue. He could not sit anywhere on the chair or table on even flat surface, because directly the bones used to come in contact. And this was an issue in him. That is how his quality of life has deteriorated rapidly. And only thing in his mind was, give me some injections, give me something which increases my muscle bulk. So these are the clinically challenging cases that we come across. Another female, she came to me when she was 70 with anemia. Then over a period of 5 years, I began telling her that what you need is an oral dentures. Okay, so that it will improve your food habits, it will improve anemia, it will improve quality of life. Every time she comes to me, she used to tell, anyway, I'm going to die. Nothing wrong. Anyway, I'm going to die. But she lived next 7 years. There's a pity part of it. She went on living for next 7 years with anemia, with poor quality of life. Later, she succumbed. So simple dentures, use of dentures in the proper way every year should be corrected. That will improve the oral health, and most of the nutritious things from the food can be achieved and absorbed to the body. Now, let us know some red flag signs. What we do as a clinician, we record the weight of the person every time he comes to our clinic. Every month he comes, we record a weight. Now, what is that we want to know is, if there is a 10% loss in last 6 months, it is a matter of concern. What we call it as a very important aspect of weight loss in the body. So it may be voluntary or involuntary. If it is involuntary weight loss, it is a red flag. And we look for the waist size. If it is more than 102 centimeters in men and more than 88 centimeters in women, then again it tells the patient is having a nutritional disorder, especially the obesity. Then we look for temporal wasting. This is a bone just up in front of the ears. And if anybody loses the fat in this area, that is the last area of fat to be lost in the body. So that tells that there is a severe nutritional involvement in this person. Proximal muscle weakness is the 4th red flag sign. What will happen if it's proximal? Yes, it is lead to difficulty in squatting. He cannot even squat to attend the nature's call. He cannot climb the stairs, get down from the stairs. All those requires proximal muscle activity, which again hampers his day-to-day activity. And of course, pallor. If the patient is having pallor, then anemia we suspect, and definitely it is a nutritional issue. So, rightly, Madam was telling, processed foods not only extend the shelf life, but they extend the waistline as well. So, eating more processed foods, we are putting our health into the risk, and we land up with being a fat and obese. This is just a photograph showing multivitamin deficiency in a lady who has been not eating properly because of health issues, chronic diseases. See how the skin has become dry, and there are multiple scales over the skin. So all these dehydration, all these issues are because of multiple vitamin deficiencies. Now coming to the third aspect, how to maintain proper nutrition. So culture in India, we have very good cultural influences to multiple. There are so many festivals coming up, and we also celebrate even death anniversaries, marriage anniversaries, birthdays, so many things in the home. So all those things are very good if the older people are there in the home. All these should be the part of your life every day in home. So whenever there is an issue, please do celebrate and do some special cooking, so that those 2 days they will have improved appetite and increased intake. Spend family time. Now, at least what was told in recently in the scientific community was 1 meal with the family. At least they should have 1 meal with the family together and it's very difficult in Western, most of the metro cities, but it is common in our place like us where they sit together. Now the issue comes here. Most of the older people, they don't like to sit along with their children and eat, because one is the restrictions. They will be under constant observation. Don't eat this, don't eat that. Your doctor told not to eat. Okay, लोणचं खायचं नाही. Okay, then he wanted to eat pickles, and you people start denying them. So that is how they don't want to share with you people, and you will keep constant observation. Why eating less? Why eating more? All those things. To overcome that, they avoid. So as a caregiver or a middle-aged persons, we should always respect their food habits, and a little more or less should be allowed. Otherwise, they will not eat food and land up with nutritional disorders. Traveling is another good time. They can go have a variety of foods in the various places. Visit to shrines. Especially, I've seen a lot of older people when they go for tour for 15 days. They in fact have put on weight and had a good food and a good time being spent with their friends or the families. So such small things matters even in the intake of the food. Then in home, what we can do, ideally, we tell the patient if there's reduced appetite, and I'll go for a colorful plates, mugs, jars, so that will improve their the vision. Having the colorful plate itself will make them feel more, I should eat. Okay, the taste food, smell, okay, taste. The color itself attracts them, especially the red and yellow go very good with the older people. Even with the dementia person, if there is a person with dementia in your home, these two colors will do very wonderful things, and they will definitely eat more. Add chatpata masala that is available now, that will improve the taste buds or the tongue. Good hydration is very important. Make the old person drink more water in the daytime and not in the night time. After 9, no water. Morning 8 to evening 8, at least you should have 2 liters of water, and that prevents dehydration. That also improves the stool quality and overall health in the muscles and the bones. Small meals frequently. Most of the older people comes that when I eat one chapati, my full stomach is full. So we tell them go for small 4 meals, 2 breakfast and 1 snack and 1 lunch or 1 dinner, like that, and in between fruits that can be there. And of course, to stop smoking and alcohol, only when they feel like they'll stop. Then exercise should be done not to lose weight. This is a very important concept in the older people. They have to bring, you don't want to you should not lose weight. Exercise should be done to maintain balance and improve appetite. Even if the people says that they keep coming that I have my joint pain, how can I walk, how can I do exercise? Okay, if you have good hands, just 1 liter of water bottle in the filled water bottle, and hold it and do some exercise 10 times here and 10 times there every day. So that will again improve the muscle mass and improve the appetite. So any exercise that they can do, so there has to be done that improves the appetite and the muscle. Now coming to the nutrition supplements, most of the older people, they say that give me tonic, give me tonic. It's of no use. All the foods that we eat in whatever context we are, that provides adequate nutrition if we take an adequate quantity. So protein preparations should not be used without medical prescription. Self protein preparation is harmful. It can damage your kidneys and liver. So always avoid self prescription of protein preparations. Daily nutrition supplement tonics, no, unless you are in a convalescent phase, that you have been recovering from illness, or you are in the hospital for illness. During those days only you go for nutrition supplements. As such, you don't need if you are having a quality food intake or a freshly made food. And as madam again rightly told, avoid junk foods. So in a given plate, 40% should be carbohydrates, they're full with vegetables and fruits, and 25% should be fiber rich. Only 25% should be protein and 10% should be fat. So oil, proteins, dal, all vegetables, fruits should be part of the nutrition intake that an old person should have every day and over the divided hours. Now, I just share 2 important things. One is a paradox. If I tell you that if you are overweight or you have 2 kg excess or 4 kg excess for your height and weight, then it is good thing. Then it's good thing. I'll just take another 2 minutes. It is a good thing. overweight is recommended in old age, except in few conditions like osteoarthritis, diabetes, and cardiac failure. Whereas being over, having extra kgs is always beneficial, and that is a paradox in the old age. So my dear old people sitting here, so always try to have a 2 kg extra weight than less than, that will help you to overcome the various diseases. And what the scientific evidence is that being underweight with increasing age has a deleterious effect on mortality. So your recovery will be slow and the death will be soon. So don't try to reduce the weight. Don't try to put down the weight. Have a 2 kg extra. That will be more beneficial in your life. Now, caution. Weight loss diets should be combined with an exercise program to preserve the muscle mass. Okay, so dieting resulting loss of muscle as well as fat and already have reduced skeletal muscle is a very bad thing. You should not allow. Don't go for weight loss diets. They are more dangerous. So weight loss drugs, if somebody is giving you that you can reduce the weight by using these drugs, please avoid, say no. Yes, because they don't have any study in older people, and they lead to a lot of drug interactions with the other drugs that you are taking for heart disease and diabetes. And weight loss surgery, if you are thinking, should be avoided. Please, as far as older people are concerned, please avoid going for bariatric surgeries that will have more negative impact. So in our clinical scenario, what we come across is the older people, old man, when he gets sick, the lady or home minister, his home minister, what she tells is his appetite is come down drastically, is not eating. And once he goes home and comes back for the follow-up, the home minister reports now he is eating 4 rotis per day. That itself tells us that he is off the illnesses and he is back to his nutritional track. So I recommend the reading this book, Keep Fit for Life by World Health Organization. This can be easily downloaded on this WHO website and is free of cost, and all of you can read this very important book. So take home message is universal diet is not advisable. We have variety of cultural background in from every 100 kilometers there is an different set of people and food that are available. Good nutrition definitely prevents disability and dependency. Food habits, as I told you, where is the place, cultural, and of course disease pattern and economic background. Avoid rigid restrictions of food intake in older people. This is my sincere request to all the caregivers here. Don't put a lot of restrictions. Even if you put a lot of restrictions, whenever they go to attend a marriage party or a social function, they finish that quota. They will eat 4 jamuns there and come back. No matter when 1 week how many restrictions you have done, they will eat 4 jamuns, 4 jalebis and come back to your home. So healthy food leads to a healthy life. Okay. So what I tried in last 25 to 30 minutes is, this is how if you see an older man with reduced appetite or not a good nutritious food, he should change to here with some advices and all. So if you have got any questions, anything, I'll be very happy to be with you, and thank you for your patience hearing, and thank you for being with me. Thank you very much.
Thank you, Dr. Rekha and Dr.
Yeah. Dr. Anand, you have
Now
just
we-
said. Sorry. Sorry, talking.
Yeah, I'm here.
Okay. I think Bhagwanda
May I
was
request
talking.
to kindly
I-
remain mute? And if you have a question, you
I
can please
had
raise
a
your
question.
hand. We will, yes, sir. Yes, sir, Mr. Sir, you can go ahead.
Doctor, I wanted to know about this. How to improve your body mass? Like you said, you lose muscle as you grow old, and it is difficult to sit. In such a case, how do you improve your muscle mass?
Yes, sir. One thing very important is not to allow to lose muscle mass. First thing, please, I request all the senior citizens, don't go for muscle losing activity. Second, muscle mass can be increased by exercises. The simple and the best exercise is walking, or I just told you some aerobic setting. If you can do, put the muscle in action. One walking is the best exercise that can be done, and that keeps your muscle mass intact. That's the only thing. Apart from all the nutritious food that myself and Dr. Rekha Madam has been telling, you have to follow that. That will improve keep the muscle mass intact.
How do you, you said don't reduce the mass. How are you instrumental in reducing the mass? Please explain that.
No, the question is we should not allow to reduce the muscle mass.
How we are responsible for that?
Most of the older people, when they have found diabetes, they have found hypertension, and even a 5 kg more weight, they are told that reduce weight, reduce weight. Okay, unless you are having osteoarthritis knee or a cardiac failure, don't go for weight loss. Because as we grow old, we need to maintain the muscle mass. We don't want
that's what. How do we maintain that? That's the point.
That's a good nutrition. The only thing that maintains is a good nutrition. Our plate should be full of proteins, as I mentioned, vegetables, okay, and fat even. All those constitutes for maintaining a good muscle mass. And second is exercise. And third, what you should not do is just injections or so-called steroid injections people take. That should never be done. That should never be done. That is more dangerous than helping the muscle mass.
Thank you, doctor.
Bhagwan Das ji, see, one of the things that if you notice, then when the younger people go to the gym, what do? They are told to take protein shakes, and then they're told to do exercises. So what we have to do is, from our own everyday quota of protein, we eat what we have, like Dr. Anand has told us very nicely, how much protein we should eat. We don't take extra. We take how much we need to take. But we also need to move. We need to move our arms. We need to move our legs, especially our truncal muscles, because we do not want to lose these muscles because of disuse. We're not using it. If we don't use it, it's going to disappear. So we don't want to, do that. Sir has been talking about weight loss programs. See, the weight loss programs, frankly, are never tailored for senior citizens.
Exactly.
Never. Because I am on a lot of senior citizen groups. I mean, I'm president of a lot of those groups, and no weight loss program is ever tailored for a senior citizen. As a senior citizen, I have two problems. One is osteoporosis and the other is sarcopenia. That means my muscles are weak and they are less. And my bones are brittle and they are porous. So these are two factors which stop me from taking part in any weight loss program.
Thank you, Dr. Rekha. We have Mr. Narendra who had raised his hand. So, Mr. Narendra, you can please ask your question. Narendra, sir, you can unmute yourself and ask your question. Okay, meanwhile, we have Ms. Priya. Ma'am, you can ask your question.
Priya, madam, you can ask your question. Unmute yourself.
This is Narendra.
She's
Oh,
Yes, sir. We can hear you. Please go ahead.
I have one question regarding this protein shake milk advertised by a company called Herbalife. So, can I go for this, or it is not recommended? Because they say some protein is required for old age also, and those products they sell it and they say that it is good for weight loss as well as for nutrients. But I think it is highly processed food. So, in fact, even Bournvita and all such foods, they are also processed foods. That is what I understand. So, is it recommended for our age to go for such foods, or only the natural foods which are available there are sufficient for us? Because I eat a lot. I mean, as you said, I am a little overweight only.
Good.
So,
That's good.
and I,
We are
and
happy
I,
at least to see
and
you.
and
you on the-
and to tell you frankly, I am very fit actually. So,
That's great, sir. That's what makes you fit. Having overweight makes you more fit.
but I am worried about the waistline, which is more. So
Don't
I
worry.
thought,
Don't worry, sir. Madam will answer to your question. Rekha madam.
So your question, sir, is that should I be taking any protein supplements in the form of the protein shakes and the proteins? See, my problem, sir, is not about how much extra protein you'll be taking, because frankly, if you were to take protein eggs or proteinules or your Born Vita, how much do we really take? I don't think we go beyond 2 teaspoons or more. But what I'm really worried about is the preservatives. That is, the sodium content of these protein supplements is quite high. And now I'll tell you, Dr. Anand, I'll give you an example. We actually conducted a survey with Sion Hospital. It's a teaching hospital in Mumbai, with in Dharavi, where we tried to find out how many people, how many elderly, and these are the financially constrained people of Dharavi, how many elderly had sarcopenia. And we actually did a survey in about 1,000 elderly people there. And then, and what Sion Hospital wanted to do was to give them a protein supplement. And I said, rather than that, let us make an advocacy to the government that these are the people who need to have the protein ration in their, in their ration. Bring down the cost. Bring down the cost of dal. In Maharashtra, we use tur dal as a staple dal. Bring down the cost so they can actually prepare dal at home, have a nice thick dal instead. You know? Rather than going in for proteins. Dr. Anand brought up a very good point here. He said if you want to take a nutritional supplement, it has to be under medical supervision, and has to be for a finite number of days. That means for a fixed number of days. It cannot be you're taking it forever. Same with like what he said about your vitamin A and vitamin D. These are very, very, these are supervised supplements. These are not ad lib supplements. So my suggestions are go in for your dal rather than your, rather than these other supplements.
Thank you, Dr. Rekha. Priya
thank you,
ma'am,
madam.
Sir,
Priya
yeah.
ma'am had a
Yeah,
question.
can you hear me?
Yes, ma'am, we can hear you.
It was a wonderful presentation, Ambali sir, Anand sir.
Thank you.
And Rekha madam, you are too good in discussing the matters. I am a geriatrician myself from Kerala.
Oh, wonderful.
Yes, so I have few suggestions because as sir was telling, it's highly individualized. See, you cannot give one diet to all our elderly people. So depending on their age, depending on their BMI, depending on their comorbid conditions, you will have to tailor their diet. So as one of the sirs were asking, how can we get the enough protein, or how will we know that whether our protein content is adequate? So it's always better that you can discuss with your primary care physician and then get a proper diet, because you need to have this much amount of calorie, this much amount of protein, and this much amount of fat. All is required. All the three main ingredients is required in particular proportions. That again will depend on your comorbid conditions and your age and your activity. So and I very well agree with both of you that even protein supplements, vitamin supplements, unnecessarily, please don't go for it, because it's all advertisements, and I definitely am against that. So if a person can take a proper diet in a proper proportion, actually even vitamins is not needed. And as Anand sir was saying, now it's a fashion to prescribe vitamin D. And especially with the COVID times, Even without we prescribing, our patients are all taking vitamin C, both as amla or like as supplements. So vitamin C and vitamin D, especially in the post-COVID times. So it's not a good practice. If your family care physician says that you require, then you can go for it. Otherwise, you yourself, please don't go for any of the supplements. And water, as I agree, because that is another thing which our elderly does. They consume more of plenty of water because their notion is that to protect their kidney and to protect from urinary tract infection. And as ma'am was pointing out, hyponatremia, sodium content. So it's very important in elderly. And I too agree that it is 2 liters. And I usually say time as 6 o'clock, Anand sir, not even 8 o'clock.
Okay.
Because little more early. So if we say 6, then at least by 8 they'll stop drinking. Because they have to, their explanation is that they have to take the night medicines. So for that medicine, they'll have to consume water.
Exactly.
So if I say 6, at least by 8, they'll be able to stop it.
Fine, well taken.
That's all, sir.
Thank you, ma'am.
Okay.
We have Miss Usha who has raised her hand. Usha, ma'am, please put up your question. Ma'am, you can unmute yourself. Yes, ma'am.
Yeah. So I agree a lot with Priya ma'am. I'm a biochemist by profession. And so what happens is, see, you said like vitamin D supplement should not be given and things like that. But most of the vegetarians, when you see, they have a deficiency of vitamin D, right? So that is given in the cyanocobalamin, right? We're using that cyanocobalamin. Now that is given as tablets to these the patients. Now that is one thing. Another thing which I was thinking is, see, urination. For that, they recommend taking barley a little bit, the barley water early morning. Is that good or bad? Because they always say soak some barley in the night, have it in the morning, so all your problems are, kidney problems will be off, sort of thing, right? So these are the 2 things. Now, do we have to take vitamin D? And very often people give multivitamins, right? Along with your diabetic medicines, for diabetic medicines, they also give you the multivitamin tablets. Why do they have to do that?
Yes.
So I have,
the second, regarding the water, I think Madam will answer. Recommend will answer.
Water is something that, unless you are on a restricted water intake, like if you do have a kidney problem, you do have, the heart failure problem, where your doctor has given you very specific instructions that you cannot take more than this, this amount of water. Water, I think 8 to 10 glasses are a must for everyone. If for any reason you are on a high protein diet, then in that case, my recommendation is you need to take water. Because one of the things we are seeing is when people take a very high protein diet and not enough water, they tend to also be constipated. That's one of the things that the fallouts of a high protein diet, which we are seeing when we give it to our liver patients and things like that. These supplements, in fact, a question, Dr. Anand, I wanted to ask you. The children, we usually recommend that they have their national flag on their plate. That means they must have a green, a white, and an orange, red, whatever, colored item on their plate.
Yes.
Okay.
Yes.
Now, where senior citizens are concerned, sir, very often, we tell them that have a rainbow on your plate.
That's great.
So,
New concept. That's good.
just explain the significance of having a rainbow on your plate.
Definitely, that's a good idea. And that Usha madam, regarding your question on supplementation of vitamin B12, D, I will tell you, there are 2 things I'll tell you. Even the richest country people who are eating non-veg day in and day out, even in that country, cyanocobalamin and vitamin D is sold maximum. Why? You think that the people who are eating non-veg and eating all those things have better levels? No, that is a myth. And second, I come across a lot of patients from Jain community who don't even eat onion. In them, B12 is normal, vitamin D is normal. So how to explain? Madam, I'll tell you, these B12 is also available in very few green leaf vegetables as well. Okay, and vitamin D and calcium in your milk itself. Have a glass of milk every day. That itself suffice your vitamin D and calcium requirements. And there are two questions I always put on this. When people eating non-veg have less vitamin B12, how to describe it? And people who are in, especially Jain community, because I'm not against it, when they are not eating non-veg at all, even onions at all, there in them vitamin B12 is normal, vitamin D is normal. So please try to understand. We like to clarify from our side on the behalf of your Rekha madam and Dr. Priya, who is also geriatrician. There is absolutely no role of these supplements unless it is required, unless it is found deficient. As a prophylaxis, it should not be used. It should not be used. And in diabetes also, unless the patient has to have a food, a balanced diet every day, they doesn't require any supplementation unless they have developed peripheral neuropathy or any nerve damages. Then only they can go for the supplementation and not as a prophylactic for all patients. I think I'm clear.
Yes, doctor. That's fine.
Any questions?
Thank you.
Yes, ma'am.
Yes, we
Priya.
have PS Venkateswaran ma'am raised her hand. Ma'am, can you please unmute and ask your question?
Yeah, my question is, can fruits be had at night for dinner?
Yes, madam.
If so, what fruits?
Okay, so what is it about the fruits that made you ask this question? Okay, so the only really
No, they
no, why did you ask? Can we have fruits at night? What are we gaining?
as a dinner, that is
Only
not
fruits?
not
Only
with
fruits? Are
only
you saying
fruits. Yeah, only fruits.
Okay, so now the
Yeah.
thing is, if you have at night kept a dish of only fruits, then you should have in the rest of the day, because remember one thing about fruits, even avocado as a veg, one thing about fruits is the protein content is either zero or very low. In very few fruits you have actually proteins. So which means that you have to address the factor of fats and proteins. So if you're doing that during the day and you are now almost like storing up all your your carbs, your whether they are combined carbs, that is carbohydrates with fiber, or plain carbs for the night meal. And it's that. Have you balanced it out? Have you had enough protein in the daytime? Have you had your fat intake? Is it okay? Is your 24-hour diet being, has it been actually what is recommended for you? Otherwise, you're going to go into some sort of a deficiency in one of your food items. I'm sure Dr. Anand and Dr. Priya will agree that balancing the diet is important. The timing is frankly up to your convenience and what you think your body has been able to digest. Okay? Because sometimes when you take too much fiber at a given time, you're going to get, a lot of flatulence, flatus, gases. So you may not be able to actually, it may not be good for you. And there's so many food items that come under the FODMAP, where you can get you can actually get soluble fiber being the changes that take place there, the fermentation that takes place in the body itself, and that can add to your discomfort. If you are okay. Your body can digest it. You have made up your protein and fat in your diet during your other two meals. Fair enough. Fair enough.
Thank you.
Okay.
Thank you, Doctor. We have a question from the audience in the chat. It asks, if I have diabetes, will that affect my digestion?
Uh,
Dr. Anand, up your street. Up your street.
yeah. Yes, diabetes, short-term diabetes will not affect your digestion. What affects is the long-term diabetes, especially if you are having diabetes for more than 15 years or 20 years. What we call as in medical term as diabetic gastroparesis. That will affect the digestion, and not in all patients. And that is not the only reason for having that or the problem in diabetes. There are many other issues of your if I got habits, bad habits, or if your food habits are not on time, and you are taking non-allopathic medicines along with allopathic medicines, that can also affect your diet habits and changes in your intestinal mucosa. So there are multiple factors that play important role in diabetes, because people tend to take allopathic medicines along with Ayurvedic, along with homeopathic, herbal. All these should be avoided. If you believe in one system, why don't you go for that system and take a complete treatment instead of blaming one another? But combining should not be done. That affects, right? But 10 years to 15 years of having diabetes, controlled diabetes, will not affect digestion, while other comorbid conditions like hypothyroidism, or if you're taking some drugs like in some people, metformin, the drug we used to treat diabetes, in some people it causes loose motion, and in some people it causes constipation. So it again depends upon your body makeup. So there are multiple issues, not only diabetes, your multiple drugs, the medicines you are taking, other diseases like hypothyroidism or antihypertensive medications that you are taking, that can all affect digestion process. Diabetes per se will affecting the digestion process is very, very less, maybe less than 5% of population, that too after 15 years of diabetes. I think I cleared.
Thank you, Dr. Anand.
So one more point I would like to add.
Yes, madam. Yes.
See, many of the elderly, especially from the constipation point, so they are very reluctant to take medicine. So that's why they consume plenty of water and plenty of fruits they'll add. And because they're afraid that if you start a medicine for constipation, throughout the whole life, they may have to be taking that medicine. Indirectly, they'll become dependent on that. But I think both of you will agree with me that at times we may have to give laxatives and the patient may have to take it. Because from other side, we cannot give them plenty of water. Like if they have any system failure, we'll have to definitely reduce their water intake. And if the person is a diabetic, then again, we'll have to restrict their fruit intake. So if the doctor feels or the family care physician feels that medicine has to be taken for constipation, the elderly should agree to that. Then as Dr. Usha ma'am was asking about the vitamin D, ma'am, we can always test the level of vitamin D. You can estimate it, and then you'll come to know whether you are taking in excess or not.
Yeah.
Same with vitamin B12 also.
Dr. Priya, one of the things I've realized, our state of Rajasthan, the staple, or I would say the main vegetation, what they grow there is isabgol.
Yes,
right?
ma'am.
Psyllium husk.
Yes.
And I feel that that is one thing. It's a insoluble,
Yes.
it's a fiber which could be used
Definitely.
judiciously in all constipated patients, telling them that it is not habit forming.
Yes, yes, ma'am.
The only drawback about the psyllium husk, that is isabgol, is its empty calories. I mean, there is nothing. I mean, it's not going to give you what a fruit would give you. The fruit
Yes.
would give you other nutrients which isabgol won't give you. But otherwise, it's a wonderful fiber to be used in people who are chronically constipated and who are worried about taking medicines which are going to cause. And you know, the case study that Dr. Anand showed, where you know, the almost abuse of medicines was taking place. You're taking laxatives and then you're taking anti-motility drugs. Is what happens is it leads to a lazy colon.
Yes.
And then that's that. You got a lazy colon, and then whatever you do is going to just fall short of results, you know. So
Yeah. Can I ask one more question?
Yes, madam.
Yes, Mr. Shah, please go ahead.
Regarding metformin, right? This is so for diabetes, they give you metformin, and I'm a diabetic, so I've been using metformin. But this when another doctor, when I went to him, he said, "Why don't you go into something which is herbal rather than using metformin?" Right? So what happened was I was recommended metformin along with the multivitamin and this thing, what is it, something, another drug, you know. But then I feel that the necessity for the multivitamin is not there. That is the reason why I asked you this question, because every day taking multivitamins, which is I don't know whether it's really going to be helpful. Yeah. And metformin, and nowadays, you know, the recent study on metformin also, there's quite a lot of studies being done on metformin. After long duration, it is quite ineffective.
I have some schools of thoughts, madam. There are studies that metformin is an longevity drug. It improves the longevity.
oh, wow.
There are studies which have come that use of metformin enhances your longevity. That is now used as a drug to improve the longevity. So, see, any drug for that matter, if a patient A is added metformin, he may not tolerate, but in a patient with another B, he may tolerate very well. And we have seen patients of 30 years, 35 years who are taking metformin only, and they are well maintained with their controls, sugar levels. So it again depends upon person to person, but adding multivitamins and herbal along with these drugs reduce the efficiency of either of the drugs, and neither will be effective. Neither will be effective. So I sincerely request, if you are believing in a herbal, go for herbal. Don't bring English medicine along with that. Either of the one you think, because your body has to sustain, your kidneys has to sustain, your liver has to sustain. Just because somebody tells, and once you develop complication, again you come back to a physician. So that should not happen. So metformin is still a standard drug. It is now has been proved, theories of aging. One of the drugs that improves longevity is metformin. So there is no second doubt about it. It's still the best drug, very economical drug, and well tolerated drugs among the all diabetics.
Okay.
So what about this, you know, omega-3 and I mean, what is the role of omega-3, omega-6 in elderly?
No, madam. There is absolutely no role unless it is indicated, especially in the retinopathy. Some ophthalmologists use it. Outrightly, as a prophylactic, it has no role. And adding to it, vitamin E. I have seen many older people on their own, they are consuming vitamin E, where they have read that it will not lead to dementia. And that is a false.
Oh goodness.
That, so these are false. Nowadays, what this WhatsApp University is creating is a lot of false information. So such get-togethers with senior citizens who have their doubts should enhance their doubts. And we should. I request all the senior citizens here to open up any doubts are there. We are here to clarify scientifically what is evidence-based and not depends upon WhatsApp University. Okay, so don't go for prophylactic omega-3 fatty acids and this vitamin E to prevent that. For if you start taking one medicine to prevent one diseases, in the old age you will be having to take 25 medicines every day, and end of the day you will end up with constipation, gastroparesis, and falls, polypharmacy, and whatnot all. So better to have one small disease rather than having complication of these medicines.
So you brought up a very important topic, and that is of polypharmacy. You know, and this whole pill burden that we are putting onto our patients Like, for instance, I'm a gastroenterologist, and I really don't understand why everybody and anybody prescribes a anti-acid drug along with whatever else they're given. It's not required, you know. So this polypharmacy, could you just tell all our audience a little bit about how to navigate their way through all this polypharmacy, you know?
Yes, ma'am. Actually, there are, when we say polypharmacy, it is any older person taking more than 5 medicines. There are two types. One is rational, means he needs it. Suppose the old man has 5 diseases like diabetes, hypertension, a stroke, osteoarthritis, or prostate enlargement. He has to take 5 medicines. So it is okay for him, right? Unless irrational medicine, okay, which are not at all required. That is one thing. Like Madam rightly told, pantoprazole. Pantoprazole is most notorious drug taken if long time. Short term is okay, 5 days, 10 days, it's fine. If we have seen people taking for months together and landing with renal failure. One of the commonest cause for kidney failure now is found is pantoprazole, long use in utility. Okay, and second is, now there is older people, they go to specialist for each organ. He goes to a cardiologist, he goes to a nephrologist, he goes to neurologist, and by the time he comes to us for some other reason as a complication of this polypharmacy, then we see there are multiple repetition of the same drugs. Okay, the orthopedic surgeon has written the painkiller, and the dental surgeon also has written the painkiller. Okay, cardiologist has written pantoprazole, the orthopedic surgeon also written pantoprazole, and multivitamins, though they are flooded. So what we do in our geriatric practice is, at least in a month, we tell the older person to get all the medicines that they are taking, irrespective of the specialty. Okay, of course, we tell them the which we don't understand, these keep it away. But in our own medicines, polypharmacy, if it is rational, it is required for that disease, even if they are 6 in number, okay. We look for interactions. Are the drug interactions going taking place? If not, go ahead. If there is irrational drug prescription, okay, or double prescription, and the drugs which are not at all required. Some older people are very smart when they are going in the walkers club, and they say that I am sure to Dr. Ambli, it is not coming down. So the another old man says very smartly, you take this drug, it will be good for you. So that should not be tried. That should be avoided, because what is good for you may not be good for him, the other person. So like that, polypharmacy goes on adding. And madam, to your surprise, what happens in my practice is, if I write only 3 medicines for an older man, he keeps on looking at me as whether doctor has understood my disease or not. Only this many. And I said, this much is enough for you to live long instead of taking many. But I still feel weakness. Can you write some vitamins? So like that, things keep happening. So somewhere it is we who should stop unnecessary medicines, and the older people should become aware that don't take medicines unnecessarily, and don't request the doctor to write medicines oral. And whenever you have plenty of medicines, go to a physician, ask him which is really required and which is not required. So most of the medicines for asthma, like derifalin, it produces taste disturbances, what you call dysgeusia, and they keep eating less. So what we do, we change that medicine from derifalin to doxorubicin, so that does not interfere with the taste. So simple things are there, like metronidazole. When you want taken for 3 days for dental abscess or something, it is such a taste-changing medicine. The whole tongue will become worst. But it is for a short time. The once you stop medicine, your appetite and change of the taste will takes place. So it is we who are there to counsel you. Take our opinion, ours is an evidence-based experiences, and that we are sharing with you. And don't fall prey to any messages that comes that will improve your brain or muscle or strength. They're all WhatsApp University. You don't have to believe in them and put your health at the stake.
So one more.
I will take one more question. Dr. Subhashini, you had a question for us. Dr. Priya, I'll just come back to you right after this question.
Okay.
Dr. Subhashini, you had a question for us. Can you please unmute and ask the question?
Yeah.
Yes, Dr.
I
Subhashini.
tuned in late because I was unable to connect. But I found at the point I tuned in, there was a lot of talk about protein. So maybe you had discussed it before I entered here. But I was thinking of nuts, because even peanuts, which are so cheap, are very rich in protein. So in that context, I wanted to add this.
Subhashini, absolutely.
Yes,
You're
Pranav, I agree
very
with you.
right.
Peanuts, poor man's cashew nut, everything is there available. But now people are fed of having medicine, like so supplementations. And there is no jadoo that you take proteins today and you start working up tomorrow. It will never happen. And you rightly put it, madam, just a peanuts or even jaggery. Most of the times it adds to your taste and stamina. So small things are there already in our kitchen, which our grandmothers have kept preserved. But unfortunately, we have stopped seeing them, looking at them. Somewhere we are putting a blind eye to that, which should be opened up, and awareness has to be there, as you put it rightly, madam. Even peanuts help us a lot.
I come from a family of doctors. My father and grandfather were doctors.
Right.
And I'm a PhD, but I'm not a medical doctor. But the point is, there's so much of talk and we read a lot. So one knows also,
How old are you, madam?
That's a very...
Now, I wanted to know how active you are at this age.
Well, I'm mentally active, yes. Physically, I don't know I'm active as I should be, because I can walk around the compound and all this. But I think after this COVID, those 2 years I was very upset and very nervous about going out. And because I'm an asthmatic, Dr. Satish had said only one thing to me before it started. I said, "Doctor, this thing is around and, oh, it hasn't yet come." I said, "What, when it does come?" He said, "Just stay indoors." He said, "Don't go out." So
that's great.
I was sort of stuck indoors completely, except in the compound. And even that was done in a very gingerly restricted manner. So I feel that, that has, in a sense, upset my physical activities. But mentally, yes, I am active. I have a PhD.
Great going, madam. Happy to see you and happy to know you.
Dr. Anand, if I may just tell Subhashini something. Subhashini, if you're at home, okay, and you can't go out, and you feel that your activities are restricted, just do figure of 8 walking. All you need are 2 chairs, 6 feet apart, and you just go and do figure of 8 walking. That is going to help you physically as well as, in fact, mentally. I'm sure Dr. Anand will tell you how exercise can also improve your mood. So, and so just figure of 8 walking.
Okay.
We learned it from bees, but I think it's a wonderful thing to do.
Thank you.
We have Mr. Nagraj Rao with a question. Yes, sir, please go ahead.
My name is Nagraj Rao. You will be happy to know I'm 84 plus.
Wow, wonderful.
God has blessed me not with any of these ailments of diabetes or hypertension, but I'm having osteoarthritis because I played tennis for 35 years without taking any support from anybody. And even now, I'm quite safe because I have started yoga on my own. And with the yoga, I have been able to avoid any of the medicines. For your kind information, I have not met a doctor for the past 7 years except for the vaccine, and I have not touched the antibiotic for 7-8 years. I'm doing regularly yoga, pranayama, and the jalaneti. I have overcome My prostate, I never went for surgery. Varicose, I don't take medicine. Sinusitis, I do my pranayama every day. I'm out of cough and cold and fever. I'm just wanted to bring this to your notice. Yoga is the only solution that we can think of instead of any multi-medicine or multi-pharma. For a kind of information. I'm the president of the Bangalore Apartment Federation.
Wonderful.
Thank you so much, sir, for that information. Thank you so much. Bearing in mind the time, if you still have questions, I request all of you to write into us. You can always WhatsApp us, and I'm sure we'll get back to the speakers and get the answer and respond back. Thank you so much, Dr. Rekha and Dr. Anand, for giving us such a lot of insight into nutrition, balanced diet, what we can do and what we can't do when with food. Thank you so much. I'm sure each one of us will be extra careful when we make food now, when we pack our food and start eating food. Thank you so much for the session. To all the participants, thank you so much for being patient and being part of this webinar. We appreciate your presence. We thank you, and please do be part of our webinars which are coming in the month of September as well. We have a feedback form that is left for each one of you in chat. May I request all of you to click on the link and provide us your valuable feedback. On behalf of Vayah Vikas, I would express my gratitude to Dr. Rekha and Dr. Anand for taking time off and being part of this webinar. Thank you so much.